vary depending on how many are also getting fabricated for them.
Hmm.
It can range from just the two front teeth to the front six to the upper and lower. There's, depending on the patient's smile, can really determine how many veneers that would be appropriate for that patient. And it can really depend on the lab that we're working with as well and the material that we're having them made out of. So if their starting shade's already pretty white as from the patient's point of view, and they just want a little bit more reshaping or lightening up or whatever the reason, and but that underlying tooth structure isn't so different than their end results, so it kind of blends in more naturally. That material can be fabricated at a much quicker time, but usually between prepping and then delivering, about a week, week and a half at most, depending on how many that need to get done. And oftentimes, depending on some of the aesthetic needs, we can also actually mill them in house as well. But that can vary per patient and how their bite actually comes together. The actual at home care, the day to day of it all, is relatively, ideally, well practiced and pretty straightforward in the sense of everything that you used to do, or hopefully we're doing, in the sense of just brushing and flossing,
Hmm.
rinsing with mouthwash. I would say keeping those normal routines consistent through the day in and day out of it all goes a long way in ensuring that that veneer lasts with you for a significant amount of meals.